Hello, future counselors. My name is Jason Ton, and I'd like to talk about psychopathology, the worldview, and also the biblical view. Based on the biblical view, I would describe psychopathology as psycho meaning brain, and pathology, typically the study of disease, is how we would categorize that kind of thing. From a biblical perspective, we're all fallen, and we live in a sinful fallen world, and that sinful fallen world contains disease because death was something promised to us in Genesis. Disease is certainly one of the ways that death is accomplished. So our organic brain is also susceptible to those effects of the fall, and that is, I believe, what we're talking about when we talk about psychopathology from the biblical perspective, including sin that goes with it mixed in with the spiritual perspective. From the secular perspective, they're going to approach it as basically the medical model. So we're talking cause and effect always. This is caused by this, this, and this. The cure is going to be this, this, and this. These are the treatments that we believe are most efficacious. This is what our data shows. This gives the best patient outcomes. For the most part, cut and dry, and that's going to be the model. So for diagnosing, the medical model, you're going to get that every single time. I worked in medicine for years, and that was 100% what you did. And if you couldn't, you just called it a differential diagnosis, but that was a given. So diagnosing a client from a biblical perspective, Ephesians 4:15 talks to us about speaking the truth in love. This is something we want to do caringly. We do want to speak the truth. If a diagnosis is going to bother them or stress them, we don't need to label them with that. We know the work that they need to do, so we can still deliver them the prescription, I guess I could call it, as the work that needs to be done, without necessarily giving them a diagnosis. If it makes them feel better that what they're going through has a name, then sure, why not? What is that going to hurt? WEAST 2021 discusses the stigma with diagnosis and the fear that a lot of patients have of losing their job, losing social ranking, other things that go along with having a mental illness. And in some cases, this leads people away from actually seeking help, which is what we do not want. So I would say that we would be very careful in diagnosing anyone, and diagnosing them to ourselves is fine, but as we deliver that, we would want to be careful. 1 Peter 5:7 says to cast all our cares upon God. So it's referring to anxiety, which is so common now, mental health. So the Bible does give a prescription for anxiety and for our mental difficulties in Christ and what that looks like. Matthew 17:15 speaks of a man begging prayer for his son that he refers to as lunatic, and says that oftentimes he falls into the fire and into the water. And the disciples didn't know what to do with this, and Jesus did, so he came in and he dealt with it. But this was a physical problem, and in their culture, they would consider it a mental and even a spiritual problem. It all came together, and what they would look like is maybe a grand mal seizure, from my estimation. But God does show that he is absolutely able to heal from these things. And lastly, 2 Corinthians 12:9 says says that his grace is sufficient for us. So yes, we'll have trial, yes, we'll have tribulation, but his grace is what will carry us through that. His grace, and hopefully even healing, is what will carry our clients through that as well. Thank you.